Welcome back to another episode of Becoming Ourselves. Really appreciate you taking a little bit of time out of your day to listen. Have really appreciated you all engaging with our show and listening. So, very excited to welcome you back to probably our most requested episode so far, even since we started brainstorming this podcast. Everyone has asked for us to bring on a therapist and try to demystify what therapy looks like. And so here it is. We brought on Chris Auer to talk about what should we expect in a first therapy session, how do we find a therapist that's a good fit, and a myriad of other questions. So sit back, relax, tune in, and let us know what you think afterwards. Thank you all. Enjoy.
I think therapy is the sort of thing that gets talked a lot about in our society right now. I think it's something that gets thrown around colloquially a lot, and it gets talked about a lot in society, but it kind of is like a black box to people that haven't done it, that people who don't know therapists, who haven't talked to therapists a lot. And so I really appreciate you taking the time to come and demystify it a little bit and, kind of shed some light behind the curtain of what actually does it mean to go to therapy and some of those things. So
yeah, well, and I would say it can feel like a black box for us too, because I go to work and I close the door and then I can't really talk about it with anybody. And so it kind of works both ways.
That's interesting. Yeah, makes sense. But it's fascinating to think, most of us go home and vent to our partners about work, and there's a little bit more of a barrier there, right?
Yeah, exactly. It's way more complicated. And so, even just thinking about, if you're spending time with friends and they're asking you how work is, and normally you say oh, my boss did this or whatever it is. And it's like, I had a good day. I talked with people.
Right.
So, yeah. But I'm happy to be here, and I'm I think it's good. There's this huge stigma with therapy, right? It's hard to talk about. A lot of times people don't want to talk about it. It can be uncomfortable to talk about. And so to me, any opportunity that we're talking about therapy, whether it's just like this or if we're talking about our personal experiences, I think it's all good.
Yeah, absolutely agree. And anything to make it just a little bit more accessible, right?
Right.
Totally. Well, Chris Auer, thanks for coming on. Chris is a therapist. Chris earned his master's degree from a holistically oriented clinical mental health counseling program at Lesley University in Cambridge, Massachusetts, one of the most comprehensive programs of its kind. Since earning his degree, he has provided counseling across a variety of settings, including nonprofit and for-profit organizations, government agencies, hospitals, employee assistance, and now in private practice. Locally, here in the Rogue Valley, which is local for me, local for Chris, not local for Jesse, so if you're not, that's okay. Locally here in the Rogue Valley, he has worked for both Asante and Jackson County Mental Health, and at the latter location, he trained the RN staff in counseling skills and fellow counselors in acceptance and commitment therapy. Chris, thanks for coming on. I appreciate it.
Yeah, thanks for having me.
Yeah. So I want to start this off with kind of a broad question. So we talk a lot about therapy. I mean, we just had this conversation. How does someone know if they should be in therapy? What are some of the things that someone should ask themselves when they're starting to think about, maybe I should see a therapist about this?
Right. Yeah. Yeah, it's a good question. And I think there's kind of a broad array of answers, because I think, first and foremost, it's a very personal choice about when you start therapy. And so, I kind of a metaphor that comes to mind is, how people drive their cars or treat their cars. And some people are oh, I'm going to go in for my 3,000-mile oil change every time. And some people are oh, I'm going to push that out to 6,000 miles. And then, then you got people that are just going to deal with the breakdowns, right? I'm just going to ride this. And so I feel therapy is a lot like that. I'm kind of more of the maintenance guy. I'm just going to do therapy because I think it's good and it's healthy. But other people are going to wait until things are getting pretty bad, or things are falling apart, or maybe people in their lives, family members or partners, are telling them, you need to go to therapy. I'm sick of this. I'm sick of dealing with this, or whatever it is, right? So So I think it's a really individual choice and is based on the circumstances. But I think like ideally, like the ideal situation is you're doing more preventative work and or dealing with things early in the game. Like I think the more things are blowing up in your life, then the more complicated things are, the more repercussions you're probably having, maybe the worse your mental health symptoms are, things like that. So I think the earlier that we get in and get things rolling, the better. So that's I think that would be my general recommendation.
Yeah.
Yeah, that makes a lot of sense. It's kind of I like that car maintenance analogy, right? Like it's not post accident. It can be, but it's
Right.
also you just need standard maintenance as well often. And
Yeah.
I mean, I with my car, I'm guilty of maybe 7,000 miles, but it
Right.
starts to get stressful, and you can definitely feel it. Like, this isn't completely right.
Yeah, yeah, and I think on that other end too, where people are waiting. I mean, sometimes I think there's good reasons why people wait. I mean, some people have a not good experience with a therapist. It's like you can go online and look on like the state board website and look at 100 different therapists that have done things that were not okay. And so people maybe have had bad experiences. Some people are just scared. Like I can remember my first therapy session when I was younger. I was terrified. I was like, what is this person going to do? What are they going to say? What are they thinking? Are they analyzing me? Like all these questions, right? And then your anxiety is like skyrocketing. So, so I think there can be like, totally understandable reasons why people are waiting for the breakdowns too.
Yeah. For someone that like is feeling that like fear, that anxiety around like starting therapy, what would you say to them?
I mean, I think to some degree, it's like it could just be hard. I mean, whether it's doing it for the first time or whether it's going back, and feeling uncomfortable about it, I think it could just be really hard. And so, the hope always is that when you're meeting with someone, they're good and it is a good fit. And so, ideally, if you're coming in with a lot of anxiety, then whoever you're working with is going to like see that and respond to that, and you're going to meet in the middle, and things can really like de-escalate quick because as a client, like I'm sitting down and I feel like, oh, this person like gets me, or I'm they see me, or I'm heard, and or they're not judging or shaming me or whatever it is. And I feel like that can like really diffuse things quickly. But aside from that, I think it's like doing whatever you know how to do to help de-escalate yourself. So at least you're not going in like in the middle of an anxiety attack or something like that, right?
Yeah.
Yeah, so that's something I've been in therapy a few times, and often to start out, it's like I know internally like I'm not feeling good. There was something building that said, okay, it's time for me to go to therapy. And then I do get to that point. It's like, I'm pretty anxious to go. And I feel like I have to get everything buttoned up. And I like in my proverbial suit and tie, it's like, oh, I show up, I'm fine. How much kind of should somebody, or can somebody be doing that? What are the thought processes as the person on the other side of the room?
So just so I'm clear, so if someone's coming in and they're saying I'm fine, or I don't have much to talk about, but there's a lot happening inside.
Yeah,
Is
kind
that
of.
what you mean?
Yeah, and like,
Okay.
I clearly I'm not okay, but like, do I need to get all prim and proper to like go make a first impression on my therapist? Like, what does that look like?
No, absolutely not. I would say, I mean, to me, the ideal situation is you come in most like yourself. So, if you roll around in sweats, like show up in sweats, or, whatever it is like that, I think that's good. And as far as the commentary, it's like, so as a therapist, if I'm your therapist, like I don't want you to overshare. I think we all have to like respect our own boundaries. You don't know me yet. I might not be a good therapist, right? So there's this development of trust that has to happen to support the process. And So I want people to respect their own boundaries and not overshare and share only as much as they're comfortable with. And so, so one of the first things that generally is going to happen in a therapy session is you're going to do a mental health assessment, right? And so that's going through and asking all those questions, getting history and doing all that stuff. And it's like if there's any sections as we go through, like if I ask about your childhood and you're like, I don't want to talk about my childhood, that's okay. Like we do not need to talk about your childhood. You hold on to that as long as you want, and we'll come back to it when it feels right and when you're ready, and that's okay. There's nothing wrong with that.
I think sometimes there's like a fear of like I'll speak to you. I've had the fear of like, I don't know that I want to go to therapy because I don't know what they're gonna find. Like I don't want them to like uncover things that I'm not like comfortable dealing with. Like the approach that you're talking about feels way more like there's not like a gotcha to it, right? It's more like I don't know, client led.
Yes, that I think that's absolutely right. And I don't think the gotcha. I mean, I don't think that's a good way. I mean, if you feel like I'm chasing you and trying to pin you down on something, or I'm trying to pull out something that you're not ready to talk about, absolutely, that's going to make you feel more uncomfortable, probably more anxious, and probably not want to come back. And like, rightfully so. Like, I wouldn't want to see that therapist, So I think it's spot on.
That's cool. That's cool. I think that's not the way that it sometimes gets portrayed in media, right? That I think in media gets portrayed differently than that.
Yeah. I mean, sadly, I think therapy is often somewhere between misportrayed to heavily misportrayed. And, or they portray bad therapists well. I think that's maybe a way to frame it. And so that's sad, because I think it does, it's like this is already a sensitive, precarious kind of topic. And so it doesn't help. I mean, I do think there have been shows more recently, ones that I haven't necessarily watched, but I know just through, colleagues or friends that it sounds like are doing like a better job at trying to, get closer to reality with it. But, the other thing is like therapy doesn't make for a good show. Like, it's like two people just sitting down and talking. It's like how to make that like more interesting. It's almost like you have to throw in like a bad therapist or like a super off the wall client or something to like blow it up, right?
Yeah.
So,
got to keep viewers, right? That's
right.
No,
that is the business. That is the business.
The business of TV, not the business of therapy, right?
Right. Exactly.
Yeah.
So something people talk about a lot is, or kind of the conventional wisdom is like, you have to find a therapist that's a good fit. And you mentioned that earlier. Maybe I'm a bad therapist. Maybe I'm a bad fit, even in this case. What are the key factors we should be looking for in finding somebody who's a good fit?
Yeah, so a good fit, it's going to be really person dependent for one. But I think in a general way, like you should feel really positively about your therapist. I think, ideally you work toward this sense of shared trust. So over time, I would expect you feel like you can really trust them. I think really feeling like seen and whatever that means to you, right? Like how you define yourself, like being fully seen. I think therapists, if they're doing a good job, should be exuding a sense of compassion, understanding, even a sense of like feeling loved in a way. Like when I'm really in my work and I'm really present with my clients, like I really care about them deeply. Like if anything happened to any of my clients, like I would feel like heartbreak, people going through really hard things. I mean, I have times where I will leave a session and I'm crying because I'm just like, oh my gosh, like this person that I care so much about is really suffering. And like, I feel that, like I'm right there with the people I'm working with. So it's a really personal work. And I think as a client, like, when that's happening, I think we feel that with each other. Like when we're with people that are really angry, like we feel that, right? When we're with people that are feeling really anxious, we can feel that. It's like we really vibe each other if we tune in even just a tiny bit. And so I think it's the same way with therapists. You know, when you're meeting with your therapist, I think you should feel these things. And if not right away, like over time, that should come. If it's feeling awkward, if it's feeling uncomfortable, if you're feeling judged, misunderstood, if things feel abrasive, like those are all signs that things might not be a good mesh.
Yeah.
Yeah, like that makes sense. And I think something that I'm taking out of that is my personality is going to show up in a therapy session just as a therapist. And so not every therapist is the perfect fit for every client. But that doesn't mean they're a bad therapist or a bad client. Just the match might not be there perfectly.
Yeah. I would say there are no bad clients. I don't think there's a such thing as a bad client. There's just, you know, if a client is perceived as bad, it's probably like whatever they're experiencing might be triggering for the therapist. You know, so if I have a soft spot because, you know, I have an alcoholic mother, right? And I meet with a client who, you know, has a drinking problem, and I'm getting uppity because this is like sensitive for me, and I haven't worked through it myself all the way. And so, but I'm kind of projecting onto the client, like, well, this is a bad client or a hard client. I mean, I view that really, it's more about me. And so I think that's what it comes down to. But and I think there are therapists that are practicing unethically or doing harmful things, and so I think that's absolutely true.
Gotcha. So do you, as a therapist, try to be pretty aware of, like, going off this, like, potentially alcoholic mother thing? Do you try to be pretty aware of, like, those are clients who I'm not a good fit for? And then instead of trying to strength your way, you know, through your burdens.
Yeah. So to give a personal example, so I have a childhood trauma history. And so I started out working with kids. My first two internships both were with kids. And it was tough. It was really hard. And I recognized pretty early on that I could not be a good kid therapist because of my past. And you know, so then the work for me is working on that past, but that's my work. It's not appropriate for me to be working with kids as a way to do my work, right?
Right.
So that's why I don't work with kids. You know, there are great therapists out there that do awesome work with kids, and but that's not me. So I just work with adults largely for that reason.
Oh, interesting. That makes sense, though.
And that's going to help you when, like, be in your comfort zone and be in your wheelhouse, so to say, because you're not stretching and pulling at the edges to try to be a good enough therapist. You are working in the places where you excel, right?
Yeah, working in the places where I feel like I excel and where I feel like I can be a competent therapist. Like this is a work, and people are coming to get help, and I need to be able to help and support in a competent, ethical, appropriate way. And like, if I can't do that, I shouldn't be doing the work.
Gotcha.
No, that makes sense.
So if I'm a client and I show up and, you know, I haven't disclosed much, I'm a person, whatever, and I do, like, go into this therapy session and I'm talking about my alcoholism or whatever, and that is triggering to the therapist, or that's outside of their comfort zone. What's that going to look like for me? Am I going to be told, like, you shouldn't be in therapy or you're bad or something? Or is that going to be more of a referral? What's that gonna look like?
So I think, you know, so if I'm in those shoes, I think, you know, what I would probably say is to just disclose that to you, just to say, you know, I have a history with alcohol in my family, and this is like a sensitive area for me to work around. And so I don't think, like, you know, us working together, like, I don't think I could properly support you. So it's not anything about you. Like, there's nothing wrong or problematic about the issue you're bringing to the table, I'm because of my history, I'm not going to be able to properly support you in the ways that you might need. And so let me help you figure out another option that can do this in a way that I'm not going to be able to.
Yeah. Okay. So taking a step back from like you're not in the therapy session yet, right? But you've decided that, or someone has decided that they're ready to pursue therapy. They're ready to like go for it. How does someone find a therapist? Like, I know there's Psychology Today. You can go on the website, like a bunch of people are listed, like those sorts of things. Like what is that process of finding someone that actually, the steps between I've decided to see a therapist, then I'm in the first session. Like, what happens there?
Yeah, the process should be better. I wish it was a better process. Like, this is something that I think of like AI and like things that might be able to do well is like, oh, let me like find the right match for you and then just like give you the like, I would love to see something like that. But yeah, so it's not a great process. I mean, it's like basically you got to do your homework. And I think Psychology Today is probably the best platform to search right now. And I think it's got good, useful filters, and you can, see a picture and maybe watch like a short video and read like the description and all that. But aside from that, it's like really word of mouth. Maybe you get recommendations from like your doctor that you like or something like that. We're fortunate here locally, and I'm sure a lot of other places have something like this, but some won't. But we have like our local professional organization, and so they put out a book that they publish every 2 years, and it's kind of a Psychology Today-esque publication where it's providers are like grouped by different categories and specialties and stuff like that. And, so that's helpful because it's like put out by a local group who knows the therapists.
Yeah.
And, if you have access to a resource like that, that's helpful. But that's about all there is.
So then is it like reasonable to say that there's a lot of trial and error involved? That like the first therapist you meet with may not be the fit?
Yeah, absolutely. And I would, I think it's helpful to go into therapy like not assuming that it's going to be a good fit on the first try. Because if you just think about like how, whether it's friendships or, intimate relationships, like how hard it can be to find a good match. And therapy, I think, is not so different from that. To like really feel like a good, solid match with a therapist, I mean, that could take a few runs to find that. Like maybe you work with a therapist that you like, but it's not like you don't feel passionate about them, right? It doesn't feel like a like a really ideal fit. And so to find that, I think it certainly could take a couple rounds. And I encourage that. I encourage people to, like talk with me, maybe do a consult, go talk to other people too. And then, sometimes people will come back and be like, I feel really good about this, or, I actually like this person better. I'm going to go with them. And it's like, that's great. Like, I also want people to be happy with who they're meeting with. So I think that's important.
Yeah, it's not all, you're not just trying to close a sale, right? There's more to it than that.
Right. Yeah.
That's cool. Are there like specific credentials? I know there are. This is a little bit of a leading question, but I don't know. I don't know what they are. Right. Like there are specific credentials that mean different things for therapists. Can you talk a little bit about the most common ones and what they might mean?
Yeah. So really, the most common and the most important are the licensure credentials. So there's a few different provider types. So there's counselors, which is in our state, and these are very all by state. So if a listener is in a different state, it's going to be different abbreviations. But so here in Oregon, licensed professional counselor, LPC. So that's me. I'm a counselor. Okay. There's a licensed LCSW, licensed clinical social worker, I believe is what that stands for. Okay. And so that's your social worker. And then you've got your licensed marriage and family therapist, LMFT. Um, and then you've got your licensed psychologist. Um, and then, I mean, those are the primary ones. So generally, if you're seeking therapy, you're going to be going to one of those four.
Okay.
And the first three are all master's level, and then your psychologists are, PhD level.
Okay.
Yeah.
Okay.
So
go ahead.
So what do those mean? So like
What's
the difference. Yeah. So like you talked about the counselor versus the psychologist versus the
Right.
social worker versus the like family and behavior therapist, just family
marriage
therapist,
therapist.
family and marriage therapist. That's what it was.
Yeah.
So
yeah.
so what are the differences between those?
Like, why are there so many therapists? Why is there just a therapist?
Yeah. Like what is it?
I'm just a licensed therapist.
Yeah.
Yeah. No, I think it's absolutely confusing. So a little, I can give a little historical context. So
Great.
We love
there
history.
were the PhDs, right? That was like this kind of the start of it, and then I think just a natural evolution. Like, can we do this and maybe not have as much school, right? Do we need to go for so many years and do research projects and all that in order to do therapy? So so then you've got the social workers that come in. That was like the first kind of master's level clinician,
Okay.
and then the counselors and LMFTs. We came later, and so really they represent, I would say, kind of just like different philosophical approaches and practical approaches to the work. So obviously, like, psychologists are much more like research focused. Like they're studying, theories. They're doing their dissertation, things like that. You've got so there's a doctor of philosophy, and then there's doctor of psychology, which is your PsyD versus your PhD. So the PsyDs are kind of like the equivalent, that those programs tend to be a little more like practice focused, but sometimes they're doing dissertations too. Your social work programs, are generally going to be focused on more kind of like social justice issues and kind of like organizational issues and legislative issues, and I think are generally going to be kind of gearing toward people like working in these systems, right? Maybe like working at DHS or something like that. And then, your LMFTs, those programs are going to be more focused on systems therapy, like working in groups, working with couples, working with families, looking at these interactions, these relational patterns in these systems, things like that. And then counselors, are then tend to be more focused on just like the individual work. But all of it overlaps though. So social workers that get trained in systems therapy, and they do, marriage and family therapy. I have been trained in systems therapy. So I've worked with, I work with couples, I worked with families. It all kind of rotates around. So it really, you go to your program, you get trained with kind of a focus or a specialty, and then, you do tons of training after. Like every year we have to do, 40 or 80? I should know this, but, hours of training that we have to do each year for our licensure. And so everyone's always training all the time. And so your specialty could start this, and then 10 years later, you're doing something totally different. So it really
interesting.
depends.
There's kind of this continuous like education through it and training through it.
Yeah, exactly.
And then I'd
that's
imagine you start to develop your skill set, and you start to tend to have certain types of clients that you become more comfortable with, that archetype maybe, or that specialty.
Yeah.
Right.
Yeah, absolutely. You kind of, I think, what a natural progression is, therapists, like, at first you kind of learn about lots of things and you dabble in lots of things. And as you practice and you learn new things, you start to, gravitate and funnel, I think, towards the approaches or modalities that resonate for you and that you feel comfortable practicing. And same thing with the clients that you're working with. For me, it was like, I'm not working with kids. I really need to stay working with adults, right? And so it's all over the map as to what direction people go, and even then it can still change.
Gotcha. So in my one counseling course that I took, and my other brother
we got
being
two
a therapist.
experts on this call.
Yeah.
I've heard about the brother. I've heard about the
Yes, you have. Yeah.
He's a bit more qualified than me, but learned just kind of enough lingo to be dangerous and not to actually know what I'm talking about, but know a little bit about, like, there's cognitive behavioral therapy, and then there's psychodynamic therapy, and are there other subsets? Is that like the big divide? And what do those mean?
Yeah, so there's really, I mean, in terms of like therapeutic kind of theories and approaches, I mean, really, I don't know what the total number is. It's, you can like look this up, but I want to say, I mean, in the APA, there might be, I mean, geez, maybe like 40 or 50 different sub-branches.
Yeah,
And-
more than two.
Yeah, and they all have their own kind of take on things, their own lens. I mean, even CBT, cognitive behavioral therapy, has like subdivisions within it.
Okay.
So like DBT, ACT, which is acceptance and commitment therapy. Like these are like sub CBT approaches. And so it's kind of all over. And and the other thing too is like there's a lot of crossover too. Like there were these like original early approaches, like CBT was one of those, and then there's like Rogerian, and then there's like the old kind of Freudian and Jungian stuff. And when you really kind of pull back the layers of these different approaches, like you can see a lot of the threads. Like the kind of the old like Freudian stuff, like mostly gets thrown out because some of it doesn't really make sense and was just off. But there's also some good stuff in there that gets pulled into some of these other theories and approaches. And so they kind of they're created and coined by people, right? Mm-hmm. And they almost become in a way like a business in a sense. So they have their own kind of identities, and they almost kind of want it that way, I think. But there are also these like layers where these, generations of therapies and modalities kind of cross over, and, this theory might pull a little bit from this theory, but it's different enough that it's kind of its own thing. So there's a lot of that happens.
Gotcha. And so kind of to pull this back into people who haven't gone to therapy or haven't gone to much therapy, is that something... If I'm looking on Psychology Today, should I be looking, I need a psychodynamic therapy, I need a cognitive behavioral, or should I be kind of testing out the vibes, the personality fit much more? Right.
Yeah. So there's a couple, I would say a couple considerations there. So first and foremost to me, I think the relationship with your therapist is most important, because you could, let's say EMDR or ACT we were just talking about. Like, I love ACT. It is a great approach. I have trained in it and I practice it myself. But if you work with a therapist that is not a good fit, that's not going to matter. That's out the window. Whereas I would say if you're working with a therapist that you really like and really value, they might not be doing like the fanciest approach, or maybe the approach that would typically be most effective for whatever the issue is that you're bringing. But like it's going to be so much more meaningful and powerful, I think, because of the relationship. So now that said, there's certainly like, as far as like the evidence-based stuff, like there are, things where it's like, oh yeah, this therapy just might not really have much backing to like help with this kind of issue or something like that. And so, but ideally, like that's not on the client. Like ideally the therapist is saying, oh, you're coming to me with this issue. I practice these approaches, and like this generally isn't like the best approach for what you're bringing. Mm-hmm. So ideally, like I would hope that, coming as a client, like you're not having to think or worry about that. Like the main focus to me should just be like, just focus on the relationship with the therapist and make sure it feels good to you.
Yeah, that makes a lot of sense. It's kind of there's a little bit of a behind the curtain on the therapist side, just because they're a professional, right?
Right.
And so their job is to have done the work on their end. And then I, as
Yes.
the client, will say, hey, this person's really easy to talk to, and
Yeah.
I feel
Yeah.
like I'm healthier because of it.
Yeah. And I think that, I think the guidance I would give about that piece, because it's like, yeah, there's this stuff that you are trusting the therapist to hold and address. And, to me, like, paying attention to our cues, like we're talking earlier about vibing off each other. Like if you're sitting with your therapist and like you're getting uncomfortable vibes, or you're, feeling off, or things, like whatever it is, like I think that's important to pay attention to. And, if one is comfortable enough, even bringing it up to the therapist, like if you feel comfortable or confident enough that you can say, when you said that made me uncomfortable, right? Like that would be ideal. And then you could see what happens. Cause then either it gets a lot better. It's like, oh my gosh, like, I'm so sorry. I did not mean it that way. Let me let's like fix that. Or it's like, oh, I'm just going to say more things that make you more uncomfortable. Right. Then that's feedback for you. Like, okay, let me just back up here and let's, maybe I'm not coming back for the next session.
That may be a bad fit. That's kind of a dead ringer. Yeah.
Right. Yeah.
That's interesting. Okay, so I want to pivot a little bit and talk about something that I have heard some differing opinions on.
Uh-huh.
So, what is kind of the goal of therapy? So I know there's a lot of different ways that you can take this, but a couple of the like broad categories of answers that I've heard is one that kind of everyone needs a therapist and you should be in therapy, and there's kind of this long maintenance and you're in it, and maybe you go weekly, maybe you go monthly, but you kind of go in perpetuity and there's no end date, there's no end date.
Yeah.
The other kind of angle is that you can go to therapy for a reason. And so I'm dealing with this thing, like I just lost a loved one. I'm going through a grieving process. I'm going to go to therapy to help work through this grieving process, to help understand that. And in 3 months, 6 months, a year, 2 years, like I will have tools and resources to deal with this on my own, to process it through my own, to like integrate this into myself and move on. Maybe I'm done with therapy. Maybe I've outgrown it at that point. At least in this stage, maybe I'll go back. What are kind of your thoughts about those two ideologies?
Yeah. I mean, immediately my mind goes to just the concept of breaking up, right? Like it's a sort of breakup in a sense, right? And like, how well do we do breakups in our culture? Like not good. I don't think we have a good track
Not that
record
great.
with it.
Yeah.
Right, not that great. Especially friend breakups, I think can be even harder. But so that, I think that's part of what makes it tricky. Like I don't think we do in our culture. Like I don't think we do endings well, and we don't do breakups well. Whether it's good or bad. Whether it's like we're ending therapy because someone's feeling great and it's like time to end, and we're going to end on a good note. Like it's still, there's still a breakup aspect to it. Like we're separating, we're going our separate ways. And so I think it's just it's a hard thing to navigate. And so, ideally, as with like most things in therapy, I think the more we kind of like look at it and address it together, the better it is. So to me, so like the way I work, and this is not true. Like therapists practice differently, and we're all using different modalities, and then even within those modalities, we might be using them differently. So as to like what the goal of therapy is going to be highly variable, which is exactly I think what you're speaking to. So to me though, in my work, the best goals are the ones that my clients come up with, that they decide on. So in my work, kind of coming back to like the piece about like what are we doing at the beginning of therapy? Typically I'm doing a mental health assessment. The other side of that is doing what in our field we call like a treatment plan or a service plan, which it basically I think of as goal setting. And so to me, those are best done by the client. The client is coming up with like, well, this is why I'm here. or this is why I think I'm here, or this is what I want to work on. And then we turn those into goals. And then when we meet those goals, ideally we're then checking back in, and it's like, well, are we done? Is this wrap up time? Or, maybe by that point, I think, Joel, you spoke to this earlier, like, well, what am I going to find out that I don't know? That happens a lot. Like, oftentimes we find out things that we didn't know when we started therapy. And so then, you're, let's say, 3 months or 6 months in, and we're looking at these goals again. It's like, well, shoot, now that I realize that I have this other stuff, or that I didn't know when I came in therapy, like, I want to work on this now. This is really important. So now we're making a new goal, and we're extending treatment to address that. But, so ideally there are these like earmarks in place that we hit, and we can, it's kind of like we've already had the discussion of like, yeah, when we get here, we're going to like, it's almost like a check-in. Let's huddle. Mm-hmm. Where are we at? What are we doing? Where are we going? And then we're planning together. And then you can, when it's time, then you deal with that ending piece.
Yeah, that makes a lot of sense. I like the idea of the therapist and the client are on the same side there. They're like, you're working together, you're collaborating on like when, like, has this ambition been met? What is the successful scope of engagement, to use like a technical-ish term, but like, what does this look like if it goes well? And then it's like, this has looked great, like, we're happy. Or maybe it's like, that looks great, and there's this other thing that, can we work on this? Yes, absolutely. So I like that idea of like, it's not combative, it's mutual and working together, and it's not a surprise.
Yeah, absolutely. Like, I feel like, client and therapist should feel absolutely on the same team. If there's a feeling otherwise, then there's some gap there that I think needs to get addressed. I think progress should be defined by clients too.
Mm-hmm.
So one thing that I do...
That. Yeah.
What's that, Joel?
Say more about that. Like, progress should be client-led or client-defined. Yeah.
Yeah. Well, I think, so like along with the treatment planning, as an example, I might say, okay, let's say one of the goals is relative to anxiety. So we rate a client's anxiety, and well, they rate it. They say, okay, on a scale of 1 to 10, I'm at a 7, right? So then when we're checking in later, when we're doing this kind of huddle, like, where are you at now? I'm at a 2. That's great. That's great. And then we look at that, and it's like, okay, great. So it's client defined and client led progress. And it's like, I can reflect, like, as a therapist, I might reflect if something feels incongruent. So if someone's like, I'm great, I'm doing great, but there's something else happening where it's like, well, okay, this does not match with this. I'm going to reflect that. I'll say, well, okay, hey, but what about this? Because I'm seeing this, and how does this fit in for you? But then it's like, ultimately it comes back to the client's assessment of what's real. So I'm deferring to their reality and their perception, rather than like, oh, I'm the expert and I know best and I'm going to tell you. It's like, no. I think that's backwards. I think all this stuff should be really empowering and client-led. I think that's important.
I feel like, especially with therapy, counseling, social work, what's the last one? Psychology.
Yeah, right.
All being really mentally based, you can see a lot of the symptoms, you can see a lot of the outcomes, but it's not the same way a doctor can look at an x-ray and see it is still broken or it's not broken, maybe. And so the client is, in a lot of ways, the expert of what's going on in there, even if they're working with somebody else who's the technical credentialed expert. But like, it'd be harder for you probably to say you're feeling a 7 because you just are picking up the cues, right?
Yeah. Well, I think that's the thing, is like, how can we ever know what someone's experience is? There's just no way to do that. And so the minute I'm overriding or diminishing or minimizing or altering your report about something, like I could be totally wrong.
Mm-hmm. Yeah.
I could be absolutely wrong. And even in the example of doctors, like how many doctors get it wrong? How many times do doctors look at an X-ray and they say it's broken or it's not broken, and they're wrong? Right?
Yeah.
I mean, I can tell you, like I've had so many clients that part of the therapy is like medical trauma because they were, mistreated by a doctor, they were mistreated at the hospital. They kept saying, hey, I have this problem. They're not getting listened to. So, even in these situations where things are or should be maybe a little more concrete, it's still an issue. So it's kind of a human problem. And so we have to attend to that, and we have to pay attention to that and address that and not let that drive the process. Because if I'm doing that, like I'm really starting to like override who I'm working with at their expense. Mm-hmm. And then I'm kind of becoming an anti-therapist at that point.
Yeah. Oh, that's interesting. Yeah.
Yeah, you don't want to be like invalidating. That's definitely not going to lead to a fruitful conversation. And I feel bad. No, you don't.
Wait a second.
Yeah.
So speaking about that, what are like a couple of, can you provide, maybe you can't, can you provide like some exercises that, that someone who's not in therapy could use to deal with their anxiety or deal with depression or something?
Yeah. So so I get asked that sometimes, in sessions about getting like homework or exercises. And my take, which I think might be a little unorthodox, is I don't generally just give homework or give assignments. But I think I have good reason for it, which is that like you never know how someone's going to experience what they're going to do. So for example, like a common one is like breathing, like deep breathing. Okay.
Oh, yeah.
So, for a lot of people, like deep breathing exercises can be really helpful, but for some people, trying to deep breathe and trying to focus on your breath might be anxiety inducing. And that might actually cause someone to have more anxiety or have an anxiety attack. Similarly with like meditation or mindfulness, like I find that, some people, especially when people are really like heady, like really cognitive or analytical, it can become really stressful. And then you're trying to meditate and you're trying to do it, and it's helpful, and so I'm gonna do it, gosh darn it. But then you leave stressed, frustrated, feeling ashamed because you should have been able to do it, and then all your inner voices are triggered. And so to me, like good exercises are ones that are really specific to each person. And it's like, so whenever I assign homework, I have a session about the homework. So if someone comes to me and says, I want homework, I'll say, okay, let's talk homework. Next session, we're going to talk about homework, and I'll spend a session like figuring out what works, what doesn't work, what makes you feel this way or this way. What have you tried before? And then we hone in on like a really specific practice, whatever it is, that's going to work and be helpful and effective for that person. I think that's really important.
Yeah, that's very curative, right? It's very curated for the individual, and it's very specific to their needs and experiences.
Right.
Feels very counter to like TikTok therapy.
Which I'm not familiar with. You'll have to tell me about TikTok therapy.
Just kind of the quick video of like, if you're anxious, here's your 5-step process to not be anxious anymore. And not always a specifically bad idea. Like you mentioned, mindfulness can be helpful. A lot of people get a ton of good out of it. But again, like you say, maybe it becomes this like, oh no, now I'm overthinking, now I'm bad at mindfulness, and I'm feeling worse than I was when I started. That's not even mindfulness is bad, but it's just kind of the self-talk environment can be volatile,
it's just,
right?
Yeah, it's like we're all different. We're all different. Like we have ways in that we're similar. We have ways in that we're really different, and we have different triggers. We have different voices, and and all this stuff is like in us, right? There's not like a way to like show someone. So to me, that's the piece. Like we have to look at that and sort that out. So then it makes sense. And to your point, like yeah, all this stuff, it's all good stuff. Like deep breathing, great. Mindfulness, great. There's many others we could list, but it's at the end of the day, it's got to actually do what it's intended to do or how it's intended to be helpful.
And that feels to me kind of like one of the places a therapist can provide a lot of more tangible value is like having a plan that you can go back to and say like, hey, I tried this deep breathing and I found it didn't work. Like,
Yeah.
is that okay? Or am I even worse for that kind of thing? And be able
Yeah.
to have a dialogue with somebody who's trusted, right? Who's,
Yeah, 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 absolutely. And I think ideally in therapy, you feel okay or comfortable talking about anything, like anything that you're questioning or wondering about, whether it's something like mundane, like about a breathing exercise, or if it's something really intense, like childhood trauma or whatever it is. I mean, that's another good sign for if it's like good, is that if you feel like you can really talk and express and show your full self.
yeah, absolutely.
Yeah. Okay, so before we kind of wrap, because we are getting up close on time, I want to talk about a couple of things that are more specific to our listeners. So we talked to a couple of our listeners about what are things that they would like to if they could ask a therapist, what would they ask? And I've got two big things. So one of them is about BetterHelp or Talkspace or some of these kind of subscription-based apps where you can go and get therapy through your app, and I don't exactly know how they all work. I haven't personally done them, but that's sort of a thing. Do you have experience with those or thoughts on, is that a realistic medium to get beneficial, nice therapeutic help, or is that something that maybe some people are going to get something out of it, but really it's kind of like it's kind of a knockoff version?
Yeah, yeah. No, it's a good question. So I also do not have personal experience with the platforms, and I haven't looked at them, so I couldn't speak very specifically about it. But I do know that they well, at least for, is it BetterHelp?
BetterHelp, yeah.
I forget if that. Yeah. So I know it's true for BetterHelp that they have, actual therapists. Like they're basically, you can think about it as like contractors. Like they're, kind of like creating these contracts and creating a provider pool. So, I think that's like the first thing is the platform. Like, are you actually meeting with a licensed therapist? And aside from that, I think part of it is just personal choice. Like, I think more and more people are like on tech, they're on phone or whatever doing text. And so for some people, that's going to work better. If you're someone who like really has a hard time just talking, right? Or like sitting with someone, like maybe kind of an online text or email platform is going to be a better fit. And maybe you get to a point where you can sit in person, but like maybe that's a starting point. And maybe that's just how you want to do your therapy. And so I think absolutely, like these sites, the ones that are doing it appropriately, like, I think it's legitimate. But what I would say is that often, not always, in businesses and agencies, is that you have a situation where you have like an owner or a set of owners that are profiting right off of that. And so typically, if you're a therapist working in that, under that umbrella, you're only getting paid whatever portion of the earnings. If insurance is reimbursing, let's say $100 for a session, and you're a therapist under whatever organization X, maybe they're giving you 50%. So you're getting $50, and then the organization is getting 50, right? So that's my only kind of concern about those situations, because therapists generally are really nice people and really genuinely want to help. And so I always hate to see that exploited, and traditionally, at least compared to like medical counterparts, therapists tend to get heavily underpaid, comparatively. So, so it's just something that I'm always mindful of with that. But I think, it's just like do due diligence in looking at the platform and who you're going to be working with.
Yeah. Yeah, I mean, I think the incentive thing and the financial side of things is a really important call out. Jesse and I have talked on this podcast before with some other people that like the incentives drive what happens. Like that's where the results are coming from is what are the incentives. And so,
Well, the other side of it is also like how you practice. So a lot of times organizations will say like, hey, this is how we do things. You need to kind of follow suit. So then we have the situation where a therapist is like, well, I really kind of am like this, but I have to like be this way in order to kind of like keep my job. And that's really not an ideal situation. But that said, I mean, I think there are wonderful therapists that work in all these organizations. But it's just, things to be kind of thinking about.
Yeah. Yeah, I think that's important. Okay, another question from listeners. From Jordan. Jordan, if you're listening, this is for you. So Jordan is a first responder. We've got several listeners that are. And first responders deal with a lot of trauma. That's something that they encounter on a regular basis in ways that I work in sales, in ways that I don't, right? And so can you speak to therapy for first responders specifically? I know that you talked about like the LCSW who works more with like organizations and works more in like that sort of a sense. Are there kind of therapists specific for sort of a first responder that like that's their specialty?
Yeah. Well, so hi, Jordan. So the funny thing is that I've worked with first responders. So I used to do
look at this
employee assistance and worked with first responders. And so I've, some familiarity in this area. I mean, it's definitely a very specific specialty. Like, I don't think there are a lot of providers out there that are like, I focus on first responders. I think it's so needed. I mean, yeah, absolutely. I mean, all first responders are constantly subjected to trauma. And even when, I think what happens with a lot of first responders is it's like a similar thing that happens with soldiers. You kind of just have to like stonewall, right? And everything has to get put away because, someone's dying and you're like, oh, this is a human life with parents and kids. And like, oh my, like you're going to like the normal human response might be to just like, be like, oh my gosh, like how tragic, or to kind of like lose yourself. Right. But, first responders, like they're working. They got to they have things they need to do. They need to be on point. It needs to be fast. They need to be on, it's like, and so all that stuff has got to get put away. Otherwise they can't do their jobs. And so what I find tends to happen is like, when stuff does not get processed, we talk a lot about this with animals, like something happens and animals have their like natural animal response. But when we're working a job, when we're wearing a hat, we're in a role and we're forcing ourselves to do something that is not natural, we're working against like our body's own natural way to kind of like process and work through whatever horrific thing that we're dealing with. So doing that over and over again, and add to that we're also, I would say we all work too much, right? So first responders, a healthy first responder schedule might be like maybe you work 3 hours in a day. Then you work 3 hours the next day. And then, maybe total in a week, you work 20 hours. Like to me, that would be like a reasonably healthy first responders schedule. But no. They're working, you got police officers working like 60-hour shifts or weeks, it's so then you have that on top. So that's like a compounding factor. And so there's just no way to process all this stuff. And it's just a barrage, right? Emergency after emergency, violence after violence. So it's really, I really liken it to like being a soldier. It's a similar thing. And And so, and then there's the secondary trauma of like not just what you experience, but then you're constantly hearing about all the other trauma. So then I go back to the office, and then Joe's telling me about this call over here. So it's just, you're just inundated with trauma.
Yeah.
So I think to me, first responders, like ideally counseling would just be like, that's part of your shift. Like you also go to counseling, and we're going to pay for you to go to counseling because that's the healthy, ethical, right thing to do. Like that's what I would like to see happen for first responders.
Yeah. Yeah. They deal with a lot, right? They're on kind of the front lines of a lot of things, right? So, yeah. Very cool. Well, thank you for talking to that. The last one that I want to talk about, this one is from Noelle. Hi, Noelle. So, man, we're doing a mailbag show. I love it. So one thing that Noelle and I have talked about a number of times is so society throws around a lot of terms like ADHD, OCD, migraines, like these sorts of terms, even anxiety and depression. Like these are terms that get used a lot in media, colloquially. They get used a lot very casually. And is this something that, I don't want to say like cheapens like what they actually mean, but how does like their use in the world so commonplace, how does that impact people that really are dealing with these things on like a serious level?
Yeah. I mean, I think it's hard to say because they're used in so many different forms and in so many different ways. And I think people feel differently about these things. You know, I think one person could feel great to hear people talking about a condition that they've been diagnosed with, where other people might feel offended that people are talking so casually about it. So I think it's very person dependent. I mean, I think just in a very basic way, just talking more about anything is generally a good thing. So I, as a therapist, like I like that there is just more talk, whether it's good or bad. You know, that's you know, it's like that's going to vary, but I think that that's helpful. And I would add that what I find a lot in the work is when like there's a lot of misunderstanding about diagnoses. And so what I find is that, you know, a lot of times I'll be talking to someone and they'll say like, oh yeah, my mom has, you know, bipolar or, you know, whatever it is, right? And so these diagnoses are being tossed around. But when we really like look at it, it's like a lot of times it's not accurate, right? Or there's not enough information, or no one has actually made a diagnosis. Like someone hasn't actually been diagnosed. And so I think there's definitely a lot of misunderstanding and misinformation. And the other side of it is also like, you know, it's easy to look up a diagnosis and just like read criteria, but it's another thing. Like part of the therapist side of it is, you know, when you've worked with like, you know, 200 people that have been diagnosed with ADHD, you see the bigger picture of it, and you're working with it, and you're seeing symptoms and you're feeling symptoms, and that's a whole other level that goes into the diagnosing than just reading like, oh, you know, hyperactivity. Like, what is hyperactivity? I mean, that could be like so many different things, right? There's this like huge spectrum of hyperactivity. So where does normal hyperactivity start and stop, and then where does like ADHD start? And you know, it's like there are all these complicating factors. So
yeah, that's it's a lot bigger than like, you know, the WebMD bullet point list or something, right? They're like right. And some that are less common that we just don't see as much, like anxiety, I think, you know, people can relate to more. But when we're talking about things like mania or, you know, if we're talking about like, I don't know, an eating disorder, something like things that we're not going to have as much kind of like relatability to, that also can make it a lot more easy to misunderstand. Yeah. Especially again, like given we addressed this a little bit earlier. I don't mean to rag on media today, but like there kind of is like the portrayal of these things in media, right? That you see in, I don't know, M. Night Shyamalan, a lot of his movies, it's like, oh, the person was schizophrenic and that's why they're doing all this stuff, right? And there's like a lot of this sort of, it's used in interesting ways in media that I think it's not always like an accurate portrayal of what it looks like.
Yeah, and I think it's important that we also come back to this piece about not feeling like we're the expert. Like, oh yeah, I know. Like, what I think I know might totally be wrong in like 10 years. So why am I going to like totally project that on you?
Yeah.
Right? I mean, it was one or two books ago of the DSM that if you were gay, you were diagnosed as having a mental health issue. You were homosexual, wow. Right? Yeah. And that was a dysfunction and that needed treatment.
Yeah, we've come a long way since that.
This was only like 30 years ago or something.
Yeah.
Right. So I think it's important to remember those things.
Man, I like that. Yeah. Like a healthy dose of humility for everybody involved, and some of the dangers of self-diagnosing and some of the dangers of like just the lab coat and pen and I diagnose you with XYZ, right. and there's in some cases, like I almost imagine it doesn't completely matter what the diagnosis is. It's more about dealing with like what's the next step, how do I best interact with my circumstances, myself, my surroundings.
Right. I think some diagnoses I think matter more than others, but as a general rule of thumb, it's like a lot of times the work is gonna happen regardless of the diagnosis. So whether you come with anxiety or depression or whatever it is, like we're going to come together, and if we're doing good work, we're going to do it. We're going to do the work, right? And so then it's like that's where I think the diagnosis really becomes less important, because we're going to get at it regardless. It almost doesn't matter what we call it necessarily. Yeah. And I'll even another unorthodox thing I do is I will collaboratively diagnose with clients. So kind of like ethically at the end of the day, like I have to be the one that does I'm putting down the diagnosis.
Right.
But I will talk through, you're meeting the first time and it's like there's this picture. It's just like a partial picture of this person's life. I have like 30 minutes of like a lifetime, right? So what fool am I to say, oh, I know what's going on here, right? Like, come on. So it's like, I could say, here's a couple diagnoses that could kind of fit what you're describing. Like, here's the platter. Like, what resonates to you? What's it feeling like to you? Right? And then we use that feedback to then go into the diagnosis.
That's interesting.
Yeah, and that again kind of goes back to what you were saying about the client sets some of the goals, and client-led therapy is like, maybe something's just like, even if that's the case, it feels really unhelpful, or no, that actually lines up with something else that I've been thinking about and can be really empowering. So
right.
Sorry, Jesse. I really like this whole approach of like having that, like it's so client informed that like it's not that like there's not kind of the arrogance or the hubris to be like, oh well, like we've been meeting for a few weeks now, so like I've got your answers, right? Yeah. That instead it's so collaborative, it's so like down to earth, and it's so like, no, like you like the client knows themselves better than Chris ever will, right? Like they will always have spent more time with them, right? And so
exactly.
Yeah, I really like that. I think that's very like empowering, and I think that is like that's less scary to go into than someone that is like especially as like there is like still a stigma around some of these diagnoses, right? And that like there is I think that like takes some of the fear away, like from like if I start going to therapy, like what are they gonna diagnose, right? Like what if they're
gonna find
right? And like I think that takes away some of that like fear and some of that risk.
And I would say that all those concerns are important to voice. If you're coming into your first session and like you don't know if you can trust your therapist yet, right? Like I think that's a good thing to bring up. Like, hey, I have concern about I'm going to be diagnosed, what you might diagnose me. Can there be like transparency about this? And I think that's totally reasonable. I've had, a number of people bring that to my attention. I mean, it's less relevant to me because I'm doing it collaboratively anyways, but before they
Right.
know that, right, I've had that and it's like, yeah, absolutely. Like, let's address your concerns and do this in a way that works for you.
Hmm.
Yeah, I really like that. I kind of like that as a spot to wrap up, just because we are, want to be respectful of your time. But there's kind of this combination of, you're on the same team, coming back to that,
Yeah.
and whether you have certain letters, ADHD, anxiety, depression, whatever,
Hmm.
um, you're working with the therapist, and you have control, and you work together, and you're on the same team. I just really like that as a spot to kind of wrap that up,
Yep.
and
Right. Right.
I think
Yeah,
that paints a really
absolutely.
beautiful picture, and ties in with my personal experiences in therapy, and just shows like it can be scary, but it can be so rewarding.
Yes.
Yeah,
Yeah.
I like that.
Yeah, absolutely.
Chris, do you have any other closing thoughts?
Um, if you're in doubt, try therapy.
I like it.
I love it. I love it. Put that on a t-shirt. I love it.
Right, right.
Oh, wonderful.
Yeah.
Thanks for tuning in. I really appreciate you taking some time out of your day to listen to our show. Hope you enjoyed it. I have a couple of quick notes to follow up on that Chris had emailed us after the fact to add in here. So one of them is, they're all kind of related, but we are in a little bit of a global mental health crisis with the pandemic bringing a lot of that to light. So it's harder to find access to therapists. Um, these days, many therapists are full, which is part of the evolution of sites like BetterHelp. And so, since the pandemic, it's not uncommon for therapists to take a call from somebody who've reached out to several therapists who are all full. But just be aware of that, and try not to get discouraged. Keep looking out, keep reaching out, and mention a couple of options. One of them is to look outside of your state for other virtual therapists, because virtual therapy has become a lot more viable than it once was, and there's just a lot more people offering that. So once you've cleared that with, if your insurance is allowing that, or if that therapist is allowing that, that can be a really good option. And the other one is, we talked briefly about licensure in this episode, but it's important to note that there are a ton of therapists out there who are practicing pre-licensure. These would be registered interns, people who are post-degree or at the last year or so of their degree, and are practicing toward working toward getting their licenses. Often this is a period of 2 to 4 years for the therapist, and so they are educated, they are practiced, but they don't technically have the credentials. But they are definitely a great option, a legit and viable option in a lot of states to get access to therapists in places that not everybody's looking. So just wanted to include that as a brief conclusion to all of this. Thank you so much for listening. If you have any thoughts, questions, comments, ideas for other episodes, other guests, give us a text at 503-893-2664. We'd love to hear from you. We are so appreciative of your time. Thank you.